where we're looking with cases today. The stretch goal that we had kind of set with the infectious disease team that we would think would be pretty, if we could stabilize around 8 per 100,000, we'd feel pretty good. That's down here. We've been hovering around 8 per 100,000 for about the past 3 weeks. So we have definitely been hovering in and around it. There are a couple of counties that seem to be a little bit out of whack, including Jefferson County, but ADPH continues to get data that they have to process. So, I usually wait about a week before I worry about something like this, just because it really has been streaky. As they get new data, then they figure out what date the case actually occurred and they assign it to the proper case. So I think overall, we're still looking pretty stable. It's not decreasing, but it seems to have stabilized around 8 per 100,000. Deaths have also stabilized at a relatively low level compared to earlier parts of the pandemic. The biggest thing that I've been watching lately that worries me is the hospitalization ratio, which is a measure of how many people are in the hospital relative to how many cases were circulating 14 days prior to today. And in the last 2 weeks, this has just skyrocketed to the rate it was in July when it was really, really high. Couple of things can explain this. It could be explained because people have stopped getting testing. It could be that people perceive the pandemic's over, so there's no reason to be tested. They don't want to quarantine or isolate, so they're not pursuing testing. It could be that the virus itself is more virulent and sends more people to the hospital of those infected. Or it could be that these are COVID long haulers that are staying in the hospital, for longer durations than what was previously observed. We just don't know. I've looked at the data in several different ways. I have another data set from ADPH that looks exactly at people 1-to-1, and it does appear on a 1-to-1 basis. The percent of people that are winding up in the hospital is going up. It looks like it's gone up from roughly 0.8%, 0.8% to roughly 2% in the last 6 weeks. So it does appear that of the cases, more people are winding up in the hospital. That means that the models that we had been looking at are a little bit off for predicting hospitalizations. The model would have had us evening out somewhere around 200 hospitalizations in the state, but we're really flattening out at close to 300 hospitalizations right now. But it is remaining flat. Just like the case curve that you saw above, this is remaining fairly flat. The UAB student data started to pick back up in the last 3 weeks, not above the level of concern, but definitely starting to trend back upward slightly toward the end of the semester. We expect it will now plummet because students won't be reporting. Why would they if they're not here for the next 2 weeks? We just don't think they'll report their cases to us. Cases by age. This is the same figure that you saw 2 weeks ago, but updated. You can continue to see these gray lines, which are the 58 and older group, and then the 68 plus, they continue to pull away from the rest of the age groups. Again, indicating that the vaccine is working. Those are the groups that have the highest level of vaccination coverage in Alabama. The 60 or the 75 plus, I think, are at close to 70% coverage at this point in time. So you can see the cases drop off quite precipitously. The group that's pulling away are the 18 to 27-year-olds. Their cases are starting to drift higher and higher above the other age groups relative to where they had been before. It's not surprising. This is the group that is the most vaccine hesitant and has the lowest rates of vaccination in the state. So overall, I do think it's positive. I think we're still trending in the right direction. I am concerned about the drop off of vaccinations, and I'll show you, I don't know how many of you follow the ADPH vaccine dashboard, but this is really evident here in the last 2 weeks. People just aren't getting vaccinated. The current week is always a hair behind, just so you're aware. They do pick up if you give them 4 or 5 days, but they won't pick up from this. This is incredibly low relative to where we are. When you look at doses administered versus doses delivered, this for the past 4 months, the difference between these numbers had been about 500,000. There were about 500,000 doses administered that weren't delivered that weren't administered. Now we're looking at nearly 1.3 to 1.4 million doses we're sitting on in Alabama. This is being seen at UAB as well. The vaccine clinics don't have the lines they used to have. They don't have the wait list they used to have. It really appears that demand for the vaccine has fallen off. And so that means we have to change our strategy. The people that were willing to go out and sign up and get vaccinated have done it. We're going to have to change the way that we think about vaccinations. We're already talking at UAB, do we go to the green and set up a big tent? Sarah Nafsinger is willing to do it, where we just hang out on the green for a day, come by whenever you can, bring a friend, get a $5 Starbucks card and get vaccinated. Clearly, we need incentive now to pick up these last few folks who are a bit vaccine hesitant. You can see the percents by age in Alabama, by race in Alabama. Interestingly, it's the Asian population in Alabama is the least vaccine hesitant or the most vaccine confident. And the differences by white and black they're pretty similar. Sex is as you would expect, more women than men have been willing to pursue the vaccine.